We're going to get started, and if you want to change the slide, that'd be great. We're going to get started with a brief introduction on our work at RWJF and building a culture of health, and then I'm going to turn it over to the leaders of our 4 signature research programs. In turn, each of them is going to give you an overview of the programs and the work they're doing, and they'll give you some examples of the programs we've funded over the last several years and highlight the things that you'll need to think about as you consider applying, and we'll also give you some tips for success. And then at the end, we hope to have time for questions and answers. During the webinar, you can submit questions at any time through the Q&A button at the bottom of your screen. Okay, we can flip slides. So to begin, I want to give you a short overview of the culture of health. Here at the Robert Wood Johnson Foundation, all of our work focuses on building a culture of health. And what that means to us is that first, every person has equal opportunity to live the healthiest life possible, regardless of ethnic or geographic or racial or socioeconomic or physical circumstance. And so as a society, when we approach health in an integrated, comprehensive way like this, it means that we're not just thinking about health being what happens at a clinic or a hospital or in a doctor's office, but really in every aspect of our daily lives. This is a sort of vision where health is a value that drives decisions by families, by policymakers, by businesses, and by community leaders. And this view of health and well-being really encompasses all the critical factors that drive people's health and well-being, whether that's childhood development, education, housing, technology, their jobs, the way we build cities and communities, and much more. And this means a couple of things for us. First, it means getting sectors to work together in ways that perhaps they always haven't in the past. And it also means that as a foundation, we really need a new research agenda for us and the field. And we can flip again. So we knew from the outset when we launched this culture of health vision a few years ago that we would need to create a robust evidence base if we really truly wanted to build a culture of health. So we set out very deliberately to strengthen our research capabilities with new methods and approaches, and we tried very explicitly to collaborate and work with partners in other disciplines that we haven't partnered with in the past. And so with this in mind, we launched in 2015 Evidence for Action, Policies for Action, and Systems for Action to help us uncover what works and what doesn't work to improve population health and well-being and health equity. We specifically gave the programs the charge to collaborate in new ways with new researchers and community practitioners in healthcare and beyond. And we emphasized the importance of forging partnerships with disciplines that hadn't been traditionally associated with health, things like housing or transportation or the environment. And so last year, we also launched our 4th program, Health Data for Action, to provide clinical data to research teams in new ways. Each of these programs builds the evidence base in its own unique way, and we've intentionally worked to center the programs on the various sectors that really are driving health, whether that's assessing laws and policies to determine what effect different systems have on well-being to harnessing clinical data. And we're hoping today's conversation should give you a better understanding of the 4 programs, their focus areas, and how you can apply. So I'm excited to turn it over first to Erin Hagan, who's the Deputy Director of Evidence for Action, and she's going to talk about their work first. So Erin, I'll kick it to you. Erin, you might be on mute. Oh, we can't hear you.
Can you hear me now?
Loud and clear.
Okay, great. Okay, so I just was thanking you for having us all together and saying I'm happy to be here with the 4 action programs. So at Evidence for Action, we are particularly interested in rigorously designed research evaluating the health, well-being, and equity impacts of specific program or policy interventions. And I think that's probably what we're all interested in at the 4 action program. So I'm going to try today to distinguish ourselves a little bit from each other. I think E4A is considered the broadest of the 4 action programs. While we are all investigator initiated, Evidence for Action truly has no set research agenda or priorities when it comes to project topics or issues. We're also unique in that we accept letters of intent on a rolling basis, so applications can be submitted at any time. There's no deadline for submission. And this allows us to take advantage of timely intervention, implementations, and natural experiments. We also award grants of the longest duration, up to 3 years, and we don't have a specified budget cap. So far, our smallest award is just under $50,000, and our largest is just under $730,000. We also recently initiated 2 applicant technical assistance services, design consultation and matching, to aid applicants who have a really interesting idea or describe an innovative intervention, but don't necessarily have the capacity to design or conduct the study internally to meet the standards of rigor that we've set at Evidence for Action. So we're not going to go into too much detail about those services today, but I encourage people to visit our website, evidencefораction.org, to learn more about those opportunities. Next slide, please. So at Evidence for Action, we fund a pretty wide swath of organizations and investigators, including but not limited to researchers, advocates, organizers, as well as professionals in the public and private sector. And really all sectors and disciplines are welcome, including those that are not necessarily considered health in the traditional stance. We do have a limitation, as is broadly the case at the Foundation, to applicant organizations that are based in the United States and its territories, and give preference to organizations that are tax exempt. But we actually do award grants to other types of nonprofits, and even for-profit organizations are eligible to apply. Next slide. So we currently have 32 funded projects that vary in focus and type of intervention, as well as methodology and outcomes of interest. The 3 listed here are just intended to serve as examples of grants that we have awarded and demonstrate the breadth of topical focus, methodologies, partnership types, et cetera. This first project, evaluating the food as medicine approach on health, is a good example of a cross-sector partnership between a community not-for-profit, a government agency, and an academic institution. The greening, the study looking at the impact of greening on cardiovascular disease in low-income Miami neighborhoods is a terrific example of an evaluation of a change to the built environment. Of all the 4 action programs, E4A is probably best suited for funding evaluations of physical infrastructure improvements. And the third project, Changing School Start Times, looking at the impact of student and family and teacher and community health, is a good example of a natural experiment in which the grantees are gathering and analyzing both quantitative and qualitative data from before and after a policy change occurred. All of our grants are described on our website in detail, including a summary of the intervention, as well as details about the methodology and the approach and the data and the outcomes. So again, I encourage people to visit the grantee page of our website. Finally, moving on to the last slide for our program, I just wanted to give a few tips for success for applications through Evidence for Action. First, I want to stress the importance of following the instructions in the letter of intent narrative template and the application and review system. The most successful LOIs directly answer the questions that are included in that template, and they adhere pretty closely to the suggested links for each section. We fund research that can inform decision-making, resource allocation, priority setting in the near term, and so research in which the primary outcome is to inform further research is not the best fit for Evidence for Action. And the description of the research approach is really a critical component of the letter of intent narrative. So while we recognize that applicants aren't able to describe the approach in significant detail in only 2 pages, it should be evident that the methodology is appropriate and rigorous. And we're really looking for research that's designed to draw causal inference, not just correlation. Our standard related both to actionability and the rigor of the research is tied to whether either positive or null findings can be informative. And then, of course, we do require health outcomes. RWJF is a focus on health, philanthropy focused on health, and so we require that people are measuring health outcomes in their research, although certainly a range of other relevant outcomes could be measured as well. We have a really detailed list and description of our evaluation criteria in the frequently asked questions section of our website. So again, I continue to direct people towards our website for more information. My last sort of closing point is to say I've really focused my comments so far today on our rolling call for proposals, which, as I mentioned, is open year-round. We are releasing a deadline-driven call for proposals April 9th. So in just a couple of weeks, that will focus specifically on shared values, which is the Foundation's first action area. So I do want to alert people that that call for proposals is forthcoming and encourage you to register for that webinar separately to learn more about that specific call. So let me stop there with our overview and turn, I guess, Brian, back to you for our next speaker.
Thanks, Erin. This is Priya Gandhi. I'm a research associate in the Research Evaluation Learning Unit at the Robert Wood Johnson Foundation. And I, along with my colleague, Kathy Hempstead, oversee the Health Data for Action program, which is supported by Academy Health. At the Foundation, we recognize that greater access to health data, like data from delivery systems and health information technology, enables researchers and practitioners to better answer important questions that are critical to building a culture of health. This is what sparked our interest in developing Health Data for Action, which, as Brian mentioned, is the newest signature research program. Health Data for Action is unique in that it looks to reduce the barriers that interested researchers often face in accessing rich health data. Through each funding opportunity, the Foundation assumes the role of a conduit and will work with data owners to make highly valued health data sets available to successful applicants. The program absorbs the transaction cost of accessing the data and will fund innovative and policy-relevant research projects for up to 12 months. Next slide, please. Health Data for Action is a good fit for researchers and practitioners in the public and private sector who are working with researchers. Projects can come from a wide variety of disciplines, including health services research, economics, public policy, and public health. The goal of this program is to encourage new use of the included data sets. For that reason, researchers who are currently working with the data that is being offered through that particular call for proposals are not eligible to apply. Researchers who may have prior experience with the data can apply for support for a completely new project, but our priority is to encourage research by new users. And use of the data is restricted to non-commercial use. Next slide, please. The inaugural call for proposals in 2017 offered 6 successful applicants access to data from either the Healthcare Cost Institute or Athena Health. The Healthcare Cost Institute data was a multi-year de-identified data set that included the annual healthcare claims for nearly 50 million people insured in the individual group or Medicare Advantage markets. At the time of applying, researchers had the option of choosing either 2 different views of the data, each of which offered different demographic measures, and for a 5-year block of time from 2008 to 2015. One example of a project that's funded is listed on the slide. Jason Hockenberry from Emory University was awarded a grant to use this data to quantify opioid prescribing practices for 11 common surgeries performed in children and assess associated outcomes. Those included subsequent healthcare utilization and long-term prescription opioid acquisition. The other data owner that was included in the first call for proposals last year was Athena Health. They offered a de-identified data set with BMI readings from 2012 to 2016 for each visit by a patient to an Athena Health provider. These patients were tracked longitudinally using unique randomized identifiers, and information on their demographics, the geographic location, and provider specialties were also included. Sarah Blake at Harvard University was awarded a grant to create a county-level measure of the restaurant environment, which, when coupled with this data set, could test whether changes in the restaurant environment are leading to changes in obesity and whether this relationship varies by race and ethnicity. Additional information about the grantees from the inaugural call for proposals is available at Academy Health's website. The program will offer data from different data owners with each round of funding and provide a link to the respective data dictionaries through the call for proposals when the funding opportunity is released. Next slide. Successful applicants for the Health Data for Action program will propose a project using one of the data sets being made available to answer significant policy-relevant research questions. Applications are also weighed on the strength of the proposed methodology, among other criteria. Successful studies will have the ability to inform decision makers and other key stakeholders, and should include the creation of timely deliverables for widespread dissemination, in addition to papers that are suitable for peer-reviewed publication. The next Health Data for Action funding opportunity is expected to be released later this year. The call for proposals will offer additional selection criteria, which may be a helpful reference as you start your application. With that, I'll turn it to Lisa Dubé from the Urban Institute.
Hi, this is Lisa Dubé from the Urban Institute. I'm the co-director of the Policies for Action National Coordinating Committee. And I'm here to tell you about Policies for Action. What really sets Policies for Action apart from the other programs is our real focus on the impact of policies. So we see our unique mission as supporting research that results in actionable evidence regarding how policies, laws, and other regulatory tools in the public sector and the private sector can support both RWJF's mission to build a culture of health, but also to improve population health, well-being, and health equity. Next slide, please. So we have two mechanisms of funding. The first is our annual call for proposals, which we'll be releasing our next call for proposal in the end of April this year. These tend to be two-year grants that are funded up to about $250,000 for each project. Policies for Action is right for you if your research is really designed to inform policy action, innovation, or change. And consistent with sort of the Foundation's comprehensive approach to health, we're really interested in both healthcare policies as well as non-healthcare policies that may influence health or health equity. So in the past, we've funded research that's looked at education policies, employment policies, criminal justice policies, income support policies, as well as housing policies and their effect on health. And really what we're looking for is to provide some evidence about what policy levers, how these policy levers can improve and sometimes or harm health, because some policy levers may actually have either intended or unintended consequences that are not health promoting. So while our call for proposals is really very broad, we also have some themes that are unique to each solicitation, and this varies by year. And we also, in our CFP, sometimes have some targeted requests whereby we ask for specific research on individual topics. So while the CFP is generally broad, we sometimes do have these specific requests for research that we're interested in. In terms of tips for success, next slide, please. We really are looking for projects that are examining the impact of a policy on population health, well-being, or equity, and that really fill critical research gaps that are currently of interest to policymakers. It's sort of obvious, but we really are looking for high-quality, rigorous research designs. And sometimes when people hear that, they think, oh, it has to be a quantitative analysis. We're interested in quantitative work, qualitative work, implementation analysis, but the rigor of the research has to be really high. We sometimes get proposals where the data sources should be available and of sufficient sample size to answer research questions. So as you're thinking about what your potential impacts might be, really it's important that you really think through whether or not the data support the analyses. We look at that very seriously. And then we're also really looking for dissemination strategies that are creative and move beyond the peer-reviewed journal articles. And that actually, one of our functions is to work with grantees to that may or may not have the capability to do that kind of dissemination. And so one of our roles is to develop blogs, to develop convenings and webinars that really highlight in a creative way that is accessible to practitioners and policymakers in the field. So that's another piece of the work that we do. Next slide, please. So, again, consistent with this comprehensive approach to health, we're really interested in both interdisciplinary and cross-sector research teams. So let's say you have a project that's looking at the impact of certain educational policies on health. We would really look to having both scholars in the education field and scholars in the health field. We believe that interdisciplinary and cross-sector collaboration in the field is important, but also on the research side is important. We're also interested in research, and we have funded some that couples teams of researchers with practitioners. We are also always seeking researchers from diverse backgrounds or with diverse life experiences that can really inform the research. Investigators from a wide variety of disciplines, and we're always excited when we have a really fabulous proposal from a first-time applicant to the Robert Wood Johnson Foundation. And just broadly, I think we want to encourage proposals in support of organizations that will help us expand the perspective and experiences that we bring to our work. Next slide, please. And just to give you a little bit of a flavor of the kinds of research that we fund, these are 4 projects that were funded from our last call for proposals. We had a project on minimum wage policies and health, diverting opioid addicts away from the criminal justice system and towards treatment, multi-generational effects of early life health and nutrition investments, and does the value of housing assistance impact health outcomes? So you can see from this, we've got our income support, our criminal justice, our health and nutrition, and our housing assistance policies and their impacts on health. And I think this provides a real flavor of the kinds of research that we're interested in funding. And that's it. I'm going to hand it over to Elizabeth Fowler.
Thank you, Lisa, and thank you to all of the participants for your interest in these programs. My name is Lisette Fowler, and I am the Deputy Director for the Systems for Action Research Program housed at the University of Kentucky. As you've heard, Systems for Action is one of the 4 signature research programs of the Robert Wood Johnson Foundation that are working to build more and stronger evidence to support the culture of health and the culture of health action framework. What makes our program unique is that Systems for Action focuses squarely on systems. We are interested in building evidence for how to better connect and align the delivery and financing systems that support a culture of health. The big picture for Systems for Action is that we're interested in research that can help us learn about novel ways of better aligning and integrating delivery and financing systems to support health and well-being. In particular, thinking about medical care, social services, and public health services, and the delivery and financing systems that support these 3 sectors of activity in improving health and well-being and addressing inequities in population health. Another aspect which is unique to Systems for Action is that a research agenda was developed about 2 years ago to support the research directions under this program. And I strongly encourage you to take a closer look at this agenda and think about how your project or your study ideas might align and fit within this agenda. The agenda can be found on our website, which is systemsforaction.org. Next slide, please. Thank you. So the rationale for system alignment focus of the S4A program comes from the growing body of evidence that we have, stressing the variety of social, economic, and environmental determinants of health. We know that the majority of factors that impact health and well-being in a population level exist far outside the medical care system and touches on social, economic, environmental determinants, and on the behavioral aspect of those elements as well. So like the other programs, many different sectors and systems drive health, but the problem is that our delivery and financing systems that support social, economic, and environmental strategies for addressing those determinants are often not well connected. They're fragmented, they're siloed, despite the fact that they're fundamentally trying to target the same underlying determinants of health. And so our goal through this research program is to learn about new and innovative mechanisms for connecting the dots across those sectors, that is, across the medical care, across the public health, and across the social and community services sectors to reduce fragmentation, to improve coordination and alignment and integration, and ultimately to improve health outcomes and promote health equity across those systems. So this slide shows some of the many different sectors that potentially need to be engaged in the research and in the mechanisms for system alignment. We are interested in mechanisms that can engage the health and medical sectors, such as medical care providers and public health organizations, but we're also looking for studies that can extend beyond the health sector into larger social and community service sectors and the systems that support those activities, including the food environment, education and workforce development, housing, transportation, criminal justice, child and family services, and many other systems that exist in the broader group of social and community services. All of these are sectors that are potentially relevant to the studies that we're seeking to support. Next slide, please. This slide shows some examples of the types of novel mechanisms for aligning systems and services across medical, public health, and social and community service sectors. Projects of interest could involve examining innovative alliances and partnerships, looking at new financing and payment arrangements, incentives for individuals, organizations, and communities, new technologies such as mHealth and telehealth, and community engagement, public values, and preferences. These are just a few examples of potential studies. Next slide, please. So we're currently funding 18 different projects under 2 different call for proposals. As Aaron mentioned for E4A, you can find complete details on these and all of our 18 studies on our website. This slide shows just a few examples of the current projects. We have a project that is examining the alignment of financial assistance with health and behavioral services to strengthen low-income families. Another one that's looking at linking education and health data to improve adolescent health. One that is testing a new terminology system for health and social services integration. And another which is investigating the integration of cross-sectoral health and social services for the homeless. So as you can see, there's quite a breadth of different topics that you can look at. We anticipate to release another call for proposals this summer. We don't have an open call. We have a deadline-driven call. The funding amount will likely be $250,000 over 24 months. I do encourage you again to go to the Systems for Action website. Again, that's systemsforaction.org, and join our mailing list so you can be informed of any funding announcements and also take a look at the projects that we're currently funding. And thank you again for your interest. And with that, I will pass things back over to Brian.
Great, thanks, Lizette. And we're going to have time in a minute for questions, and I would encourage you all to use the Q&A form here on the webinar to post them, and we will triage the questions here and relay them to the appropriate presenters. But before we turn to questions, we wanted to provide you with some additional resources to help get you started. Yeah, thanks. At our main website, which is listed at the top of the slide here, you'll find the program finder, which can help direct you to the right program for you if you're not sure. You can also find links to each of the programs, and you can sign up on these sites for email alerts, which is the best way to know as soon as we've released a call for proposals. We'd really encourage you all to familiarize yourself with the Foundation's online application system, ANR, which you must use to apply for these programs. And if you sign up for and test out the site before the final submission deadline, that's probably a good idea. So let's pivot now to the question and answer portion of the webinar. We've got a few here in the queue, and I'll take the first one. which is sort of a general question asking, you know, what are reviewers looking for? What questions will they ask when they read a proposal? And I think each of the presenters on today's call hopefully shed some more light on that, but I would say a few pieces of general advice. First is to follow the instructions on the CFP. That sounds kind of obvious, but I think oftentimes or sometimes applicants run into problems when they try to use a call for proposals to share their own ideas and are not reflecting the types of things that we're looking for. The other piece, and I think Lisa hit on this nicely, is the importance of rigor. And rigor can take many forms. It does not mean you have to do very complex econometric work. It can mean quantitative studies, certainly, but it might also mean qualitative studies. I think the more important thing is that you've got a strong study design and the elements of your project are rigorous. And then the third thing that I think that cuts across all the work that we're doing is sort of the so what question. We want this work to be applicable, to be actionable for key decision makers. And so we really want you to think about, you know, if your results, you know, if you complete the study and have strong results, who's going to be paying attention to these? Who can take action? Who can really use these findings to drive their work forward and to improve the health and well-being of all Americans? You know, I think the fact that each of these 4 programs has for action in its name is not a, you know, was done on purpose, and we really want to emphasize the actionability of the work. All right, so we've got a few other questions here. The first one, Lisa, we'll turn to you. Do you fund, and this is for policies for action, do you fund proposals where there is primary data collection involved?
Absolutely, we do. The only issue is that it has to fit within the budget and time constraints of the grant making process. So, but we do fund primary data collection.
Okay. Next, for PRIA and HD4A, Health Data for Action, is it a rolling deadline or is it a more deadline-driven opportunity?
We have a deadline-driven opportunity. There will be 2 stages. This will be a brief proposal followed by a full proposal, and that will be released sometime in mid to late 2018. And
we got one more HD4A question that came up in the Q&A from old friend Jim Rashofsky. Can you, Priya, tell us what data sources will be included in this year's HD4A solicitation?
Unfortunately, I cannot, but I can tell you that we're in the process of speaking with a couple of data owners. Over the years, we expect to change the data owners and the data sets that we're providing through each of the funding opportunities. But as soon as the call for proposals is available, you all will be the first to know, and please do sign up for our funding alert.
Great. Aaron, one for you. How much time generally passes between a LOI submission and eventual funding? And maybe you can elaborate on that and some of the other timeline questions that others may have.
Sure, no problem. So with EFERN, it is a great question since we don't have a deadline. We have a couple of different options. I mentioned that we are able to take advantage of natural experiments. So if it's a true natural experiment, we can often expedite our timeline to be responsive in that way. But generally, at both the LOI and full proposal stage, there's about a 6 to 8 week review period. So 6 to 8 weeks from the submission of the letter of intent until you will be notified if you are invited to submit a full proposal or not. And we do provide status updates either way. And then once there's a 2-month time frame for the applicant to develop and submit their full proposal. And then we review full proposals also about a 6 to 8 week review period. Once we recommend a proposal for funding, there's a minimum of a 45-day budget and legal review that's conducted by the foundation. So what we've seen is that the average time to receive a grant from submission of a letter of intent is about 5 to 7 months. Because we're a rolling program, we are able to invite revisions at the letter of intent or full proposal stage. And so if we invite revisions, that can lengthen the time frame a bit. And then, as I mentioned, we are initiating these 2 new technical assistance services. Those invitations will be extended during the letter of intent stage. So again, we're looking at anywhere from about 3 months for a response to a natural experiment to, I think the longest it took us so far was about a year to get an award out due to some revisions that were needed along the way.
That's great, thanks. And then just a quick follow-up. Can you give us a sense of the proportion of LOIs that advance to the full proposal stage and then the proportion that are ultimately funded?
Yeah, that's a great question. So I want to brace people for my answer. Only about 8% of letters of intent are advanced to the full proposal stage, but people should know that we've received about 1,300 letters of intent through evidence for action. At the full proposal stage, the likelihood of funding is much higher. So about 40% of applicants that are invited to submit full proposals eventually receive funding.
And then let's see. One question is, do you work with or do you fund individuals who are not research scientists or PhDs, like MDs or JDs? And I would say yes, certainly. The grantees who've been funded throughout the 4 programs come from a range of different backgrounds, and we value those different perspectives and the analytical tools they can bring to the table. So very much so. There's one question, and I don't know, maybe Aaron and Lisa, if you wanted to tag team a little on this one. You know, what happens if someone is not sure whether they should submit their proposal to, say, policies for action versus evidence for action? Is there someone that they can screen their questions with or run their ideas by, or if they submit to one program, will it be redirected to another?
Sure, Lisa, maybe I'll start and then you can add on.
That sounds good.
Great. So because evidence for action is open all the time, we often serve sort of as the doorway or the gateway into the foundation. This only really becomes an issue when policies for action or systems for action has an open call for proposals. And so the rest, the other, which usually is only about 6 weeks, 6 to 8 weeks a year. So the other 10 months out of the year, you should just submit to evidence for action. But when policies and systems for action have open solicitations, we do coordinate very closely with each other. I frequently, and our staff at Evidence for Action frequently speak with applicants and help them to discern which program is most appropriate. And when we receive applications at Evidence for Action that we think are particularly well aligned with policies or systems for action, we do share those applications with them to get their sense of whether it's a good fit or not, and then we can direct applicants to the appropriate program as necessary. And I would just broadly say that if you are explicitly evaluating a policy or a law or a regulation, and policies for action has an open call, that would be the appropriate program, and similarly with a delivery or finance system. But Lisa, and then maybe Liz, if you want to add about your programs specifically.
Yeah, this is Lisa at Policies for Action. I would say that Erin said it perfectly. And one of the issues is because we don't have rolling admissions, we have one call for proposals every year. We would be inundated with questions if we consulted on what was on proposals. So we actually don't do that sort of back and forth with grantees. We try and be really clear about the kinds of proposals that we're looking for. And if you're evaluating a policy, law, regulation, we'll be interested in reading your proposal. And but I think if we don't have an open call for proposal, talking to Erin is actually a terrific idea.
Yeah, and this is Lisa. I just want to add to that just to echo Erin's comments initially, that we're only all 3 open during very limited time periods. And when that does happen and we do receive a proposal that perhaps seems a little bit more appropriate to one of the other programs, we do talk about it, offline and figure out whether, it would be a better fit for one of the other programs.
That's great. Lizette, while you're applies to S4A and all the others, but do you have to be affiliated with an academic organization to meet the application requirements?
That is a great question, and the answer is no. You do not have to be affiliated. We funded grants where the applicant organization or the main organization is an academic institution, but we also have other projects where it's a nonprofit or a health department. So you do not, again, what we're looking at, and you can learn more about the review criteria on our website, but one of the things that we look at for review criteria is the strength of the environment. So as long as the project team has the access to necessary resources, relationships, and infrastructure required for successful execution of the project, that's something that we look at. The team has to have access to relevant data sources, computing facilities, staff expertise, communication and dissemination mechanism, and relationships with relevant scientific, policy, professional, or community organizations.
That's great. We have a question about long-term impact and what that means exactly. And maybe we could go around sort of a round robin for each of the programs to think about what impact means. The questioner is asking whether that only implies changes in sort of state level outcomes, or how are we thinking about what sort of impact and outcomes we're looking for in the programs. And maybe we'll start with Priya, since she's sitting next to me.
Sure. Thanks, Brian. For Health Data for Action in particular, it's hard to narrow down the type of impact we're particularly looking for because it can depend on the nature of the data that we're making available. But in general, the data sets are providing nationally representative data and measures, and we're really looking for innovative and policy relevant research questions that can be answered using the data that's being made available in the specific call. So we encourage you to take that into consideration as you're developing your research idea, and to also really look at the exhaustive data dictionaries to better understand the types of measures that are offered, so you can make a better distinction between whether national policy or state level policy and different types of outcomes are ones that would be a more appropriate fit given the type of research question you may be asking. I can pass it to Lisa with Policies for Action.
Hi, thanks. Yeah, so I think what we're looking for is evidence that can help both policymakers and other stakeholders basically change policy in ways that improve health, and also prevent policies that may impede health. And that can really happen at the national level, it can happen at the state level, it can even happen in the community level. And sometimes that action, you know, the research may inform an innovative policy or program at the local level that has implications at a higher level. So really it's trying to understand what works and what levers can be used to promote health, well-being, and equity.
This is Lisette from Systems for Action. I'll just piggyback on that because I think my answer is very similar to that. We have a lot of projects that are focusing initially on community level impacts, and with the intent, of course, that those are replicable across other communities. But I think that the long-term impact can be just a change initially at the local level.
So a couple of general questions, and maybe I'll take a shot at these. The first is about whether there are what the questioner calls joint proposals between multiple nonprofits or research organizations allowed and or preferred. So yes, these sorts of collaborative proposals are quite common here at the Foundation and generally, and in these 4 programs. So they are certainly allowed. There needs to be a lead organization and a lead PI, though he or she may have co-PIs who work with them and who come from other organizations. So yes, that is certainly allowed. in terms of its preferred, I mean, I think we're generally looking for diverse teams that can bring different perspectives and analytic approaches to bear on some of these key questions. Whether or not they're from different organizations, I think is another question, and I don't know that it helps or hurts. I do think that having members of your research team with on-the-ground insights or understandings about the key issues you're working with is important. It enriches the study and brings important new perspectives to the work. So that is the type of thing that can be helpful. There's another general question about whether a PI who's currently funded by RWJF, whether he or she could apply for another program, and the answer is yes to that. And again, we are looking to diversify our research grantee base, but certainly having one foundation grant does not preclude you from applying for another. Let's see. We've got a P4A question for Lisa. Let's see. For those of us doing work in an area you've already funded, in this case, minimum wage, how should the applicants think about whether or not to prepare an LOI? Is there a method for coordinating new work with the project of an existing awardee?
Yeah, that's a great question. And we actually think about this a lot because we've got a bunch of work that we're funding around housing and another pocket of work that we're funding around early education. And I think our belief is that not one study is going to make a difference. And so we do have some clusters of studies. And I can give you an example. I mean, what I would say basically is all of the studies that we funded, there's a description of them up on our website. So I would look at that study, and you know, you don't obviously want to propose the exact same study, but you know, feel free to talk to the PI and try and craft something that gets at another issue. In fact, we basically had that issue because we funded some work using an NHIS and HUD linked data set, and then in another organization was proposed to do the same, use the same data set, but basically came up with a different sort of twist on it, which will provide some different but important information. So I would say just because we funded something on minimum wage doesn't mean we won't fund something else. But look at what we are funding and feel free to talk to the researchers there.
Great. It looks like we have one more question in the queue for Lizette. Have you had any proposals related to building resilience across sectors?
That's a really good question. We currently have a proposal that's looking at strengthening or understanding the carrying capacity of nonprofit networks and any issues of how they could recover from when there's an increased load on referrals to these agencies. So you know, offhand, that's the first one I can think of that sort of gets to this question. But no, we would welcome, you know, additional work in that area.
And it looks like we've got one more, a bonus question at the last minute. Aaron, this one will direct to you. Do you bring different people or together or provide services to help bring people together from different organizations to work on the same programs?
So what a foreshadowing question. We are launching a service this early fall where we will be able to start providing that service to applicants. So if you are a community-based organization or really any organization working in a community, but you don't have in-house research capacity or you don't have a partnership or a relationship with a researcher, you can apply through the regular submission process through our rolling call for proposals and indicate that you're interested in being introduced to potential research partners, and we'll be able to start referring or inviting applicants to take advantage of that service. So more to come this fall on our ability to be responsive to that need that we've seen in the field.
Great. Well, thank you, Erin, and thanks to all our panelists today, Erin and Priya and Lizette and Lisa. We are going to wrap there. We have recorded this webinar and we'll post it shortly, and encourage you to share it with any of your colleagues who are unable to make the webinar today. We're also going to ask these great questions that you've raised here to help us sharpen our calls for proposals, the descriptions of the programs and what we're looking for, and the FAQs. And I would encourage all of you to continue to reach out with questions as you learn more about the programs and consider applying. We really do hope that you will follow up and stay in contact with us and look for opportunities to bring your best ideas to the table. Our success as an organization depends on being able to produce the best research possible, and that really relies on you all in bringing your creativity and skills to bear on these important questions. So we are looking for your best ideas, and hopefully we'll see them soon. Thank you very much, and enjoy the afternoon.